Hello, everyone, and welcome to another episode of 9x90. Today, we have a very special guest with us at the recommendation of Parker Detweiler. We have Todd Perman joining us. For those of you who do not know Todd, he is the CEO and general partner of Seed Healthcare, a $100 million venture fund investing in disruptive healthcare companies focused on early disease detection and prevention. For those of you who heard our episode and interview with Weizmann Institute, you know how much of a game changer this type of this sector is, and prevention is at the forefront for us. Especially if you go to China, you'll see they're already using preventative medicine. They barely have any hospitals left. The US really has to catch up. And Todd is helping the US to get to the 21st century with the medical companies that he's investing in. The fund is aligned with UN Sustainable Development Goals and Global Impact Investment Fund frameworks. With over 30 years of experience spanning clinical care, real estate, and investment banking. You're an investment banker? That's cool.
Yeah. Don't tell anybody though. So I'm recovering from that. So.
Including leadership roles at Stryker and Newmark, Todd has become a leading force in reshaping healthcare from reactive to proactive. He also serves on the boards of mission-driven health companies. Todd, thank you so much for joining us.
Hi, Addie. Thanks for having me on the show. I really appreciate it. And I didn't know you're really committed to voicing the challenges of preventative care and what is going on and what's not going on. I end up talking a lot on the topic of catching disease early, and our theory of change at Seed is really about diagnostics and process of care and things that they're doing overseas that they're not doing here. Yeah. And our real value is by bringing, our technology from all over the world to America. Our real knowledge and relationships are driving change at the point of care. So as a venture fund, a lot of venture funds don't do a lot of active work. We are very hands-on when we invest, and we really want to see the change happen.
But what I think is interesting is you're combining your knowledge of the clinical care space with investment banking. So a lot of people come into this arena where they're like, oh, I'm going to make preventative medicine. I'm going to bring preventative medical technologies to the main market. But they don't think of a way to make it profitable and financially beneficial for companies that want to cure diseases to switch to preventative. So you've now found a way to identify companies that are going to make it more profitable to be preventative?
That's yes. In a very short answer, the goal and what I've seen in my 34 years of healthcare is a real challenge of the break-fix model and diseases not being caught early enough. And I started studying, the idea that 18 million people worldwide die of heart disease every year. And they should know that they actually have heart disease, but most of them don't. The first time they have a heart attack is the last time, unfortunately. So you start looking at what's available today and the computing power that exists and the AI overlays of CT imaging and MRIs and diagnostics and process of care like that. And you start to see that really get to the point of catching that disease state early. And what most people think is that you catch a disease, you just sit and wait, and it's a ticking time bomb, right? That's not how it works. It actually works that if you catch it early enough, you can actually reverse it and create other outcomes that take the environmental considerations. You can make changes happen. And what I find that with most patients and most doctors, if they can't measure it, they don't do anything about it. So doctor could say, oh, you have heart disease and you have high cholesterol, you have this or you have that. And if you don't actually measure it and say, well, you actually have this much blockage in this artery, then tangibly, you don't actively create a movement for that patient. And the doctors have to actually drive that. So we're really aligned with the idea that enabling technology drives the outcomes, and the physicians have to be the driver of the outcomes and get their head up from the break-fix model of preventative and get towards preventative care. So the focus is really get the change to happen at the point of care. And in most situations, when you look at like the payer model, nobody really does the math and says, okay, well, if you have a heart attack, it costs the system, several $100,000, right? It's a huge cost.
Yeah.
Whereas if you catch, we'll call it early stage heart disease, you can actually take some therapeutics. There's various therapeutics, but there's a lot of ways just to do normal environmental things that will change the outcome of that, and reversionary approaches to getting heart disease to go backwards. And in my family, we have heart disease. We also have cancer, and I'm fortunate that I don't have any of that. However, I monitor it every year, and I do full screening programs that eliminate all the big risks for me, and that's what we're investing in. We started investing in one company that really does that across the board, and then continued to invest from our family office and grow that over the last several years. And then we decided to start the venture fund along with that because we knew we could have more impact.
I like that you're choosing heart disease as the example. I don't know if you knew, my final thesis when I got my bachelor's degree in medicinal biological chemistry was a non-invasive cure for coronary artery disease.
Amazing. What was the thesis of that? Like non-invasive cure? Was it?
So we found that an IV drip of glycolic acid. Also, you could use vitamin C. It wasn't nearly as effective, but glycolic acid into an IV effectively broke down the calcium deposits so that the body could flush it out.
Amazing. Yeah, that is exactly the premise, right? Fish oils, other natural supplements you can take actually are reversionary for heart disease, and it does flush it out. There are therapeutics that are coming that are one that I personally invested in out of my family office. We don't really generally invest in therapeutics because the timeline is so long. But the idea of a cyclotone that goes into the arteries and attaches to what's called 7-keto cholesterol. If you studied it, that's the poisonous cholesterol that hardens, and you have hard plaque and soft plaque form. That's just like the amyloid plaque that's in your brain for Alzheimer's, and that causes dementia and Alzheimer's. So that plaque, they've created an enzyme that goes into the body that's completely harmless, that that attaches to that same 7-keto cholesterol product compound, and attaches to it and then drags it out of the body through your urine. And the current test it's in safety trials in Australia right now. I think we were just talking about Australia, and they're getting great results. And the ultimate test will be the phase 2 trial. But I would be a fan you think about it. I talked to our board and our interventional cardiologists that are on our board, and they say that'd be the holy grail, right? It would put us all out of business, but they're okay with that, right? Like the real surgeons that are just passionate about actually fixing and reversing the disease, I think that's who joins Seed and affiliates with us. I think that is the difference. So it's so funny that you did that study. I wonder if that treatment got legs. It didn't go anywhere.
So my professor that was the managing professor on the project with me, like I had to run my ideas and my tests by him. This is getting a little bit deep into politics for those who don't know how political medicine is in the US. So once we had proved that it was effective, he got a letter from the American Heart Association or one of those entities, and he held it up for me, and I was like, what is that? And he was like, game over. And I was like, what do you mean game over? And he was like, sit down, kid. And I was like, okay. When you're like 21, 22 years old, you just want to help the world. You don't understand the economics of like curing one of the biggest killers in the United States. So he was like, do you understand that if your research goes through all these trial phases and it goes to the mass market, that all of the heart surgeons in the US will essentially be put out of business? And I was true. Like, no, I didn't think about that. He's like, well, they're not happy. So I used it to graduate, and then the school just like left it. I had another friend, she went to Harvard, she found a cure for kidney cancer.
Oh, well, yeah, amazing. And what happened?
One of the big pharmaceutical companies came in, bought her research and shut it down. Yeah.
Unfortunately, that happens. I mean, we've seen companies, I think you mentioned my background. I was with Stryker, and US Surgical was, I'll call it the first half of my career. I was centered around medical devices in the clinical environment, and I ended up running sales for Stryker, running divisions, doing all sorts of things. And in the long run, there were companies that were competitors, Medtronic, many would buy companies and just shelve them,
Yeah.
because of the IP, and never really wanted to go to market. In orthopedics, it happens all the time. And, I think it's unfortunate because it's blocking some innovation. However, most of the big companies are not products companies anymore. They're just big sales engines that really drive access.
Yeah.
And if you really think about the change and how it needs to happen, you actually have to get a smaller company that's fleet-footed to penetrate the environment and really drive that change, with the physicians and the clinicians. And unfortunately, it doesn't happen without intention. So a lot of things sit on the shelf, and a lot of things like your friend's research, go by the wayside, and that's unfortunate. We actually have one of the largest nephrology groups in the country, and if you saw how big, you have kidney disease as an example. Just to take that as an example, there's about 400 billion spent on treating kidney disease in the U.S. every year, and if you double that, pretty much on almost every category, if you double that, that's the worldwide TAM. So we spend about half of whatever the healthcare costs are in the U.S. in the world on each category. So whether it's heart disease or whatever the total amount is, that's what it is. And this particular practice is 1,200 physicians in 600 locations around the country, and their whole goal is to treat and catch the disease early enough, both the cancers and the actual kidney disease, to make sure that people don't ever make it to dialysis. Whereas you have Fresenius and DaVita, who I'm not going to say that they don't have care about getting patients on dialysis, but once patients are on dialysis, the only way to get off is to get a kidney transplant. So you think about that, the spend in that, once you're on dialysis, is just a perpetual funnel of expense, right? So that 400 billion just keeps going exponentially. And so when you start really looking at how you catch disease early, it's testing, it's diagnostics, it's process, it's genes, it's actually mapping those genes and actually really looking at the detail. And the truth is always in the details. So for me, it's a very strong movement that you're starting to see, that the physicians actually care about treating the patients and keeping them well, as opposed to shifting the policy. The governmental policy is still behind, but I think we've got some movement there, and we can talk about that and value-based care and what's happening if you're interested in that.
Yeah. So we did get a little bit sidetracked.
It means it's fun. It means it's a good conversation, right? We did.
That happens from time to time. So let's go back to your questions, because we did have some objectives for today. So Seeds Fund focuses on early disease detection. What criteria do you use to identify true disruptors?
That's a great question. The focus is generally we're leveraging the big diseases, and we're categorizing our focus on each of the big spends that we see. I'd say the big ones are heart disease, cancer, brain health, metabolic health, and even mental health is a big focus. And we've broken our fund and venture strategy down into categories that really focus in on those different categories. So as many venture funds will say, well, we're going to invest a percentage in this, a percentage in that. Our allocation strategy is based on each specialty and really where we can move the needle the most, and create more access and democratize the access to the real diagnostics that are going to be low cost and drive the bigger outcomes. So our venture strategy impact is there, and then we've gone out, and just like the board member that I just mentioned, the largest nephrology group in the country, we have key opinion leaders that actually weigh in on all the technology, and we review every year. Well, what is moving in the category, and we chase down those companies that we think are going to be most impactful and meaningful. So it's a proactive, strategic approach centered on each specialty and each clinical process. And that's a very unique lens that we look through when we're trying to decide what to invest in, what not to, whether it's genomics or things that are really going to move the needle in cancer care, or something around kidney disease or heart disease.
My mother-in-law was on dialysis for 15 years.
Wow.
Yeah.
Wow.
Yeah. So
did she get a kidney and
she,
did that?
So she's Israeli, and in in Israel, the transplant selection process, it's done by age.
Mm-hmm.
So she was in her 60s when they discovered she'd need a transplant. So she was like at the bottom of the list.
Oh,
So
wow.
she ended up, after 15 years, she ended up passing from it. But
I'm sorry.
thank you. They did say that they were surprised because most people who go on dialysis only live for like 5 to 8 years. And she lived decades past what they expected.
Wow.
Yeah.
Wow. I mean, that's so you've lived it, you
Oh,
know
yeah, yeah.
what that looks like. It's not pretty.
No.
It's not a it's a very debilitating process because you have to stop everything you're doing and go for dialysis very routinely.
Yeah.
And it's disruptive to the family, it's disruptive to everybody around you.
Yeah.
So definitely want to do more about it. That's the mission.
So for those of you who don't know what kidney dialysis looks like, essentially 4 times a day, my mother-in-law would have to go into her room for about 30 minutes to an hour to have these bags flushed through her system. And she had to have these holes put in her body where the fluid could come in. And so she couldn't go swimming. She couldn't travel anywhere. The most she could go, she could only go within 30 minutes, 45 minutes of the house because she'd have to be able to come back within a few hours to do her next dialysis. So it's one of those things that once you're on dialysis, you're stuck to one location, which for people our age that live or in this time that live on airplanes and travel to countries all the time, it's like to think about never being able to go more than 45 minutes from your house. It's just crazy.
Yeah, it's a very debilitating process. And you know, there are technologies coming that make it more portable, but the best thing is to never get there and catch that earlier and keep people from getting, to the stage 4, which is where you end up with dialysis. That's what the doctors are committed to that we work with as well, which is very unique, actually. So.
I know we weren't going to talk about specific companies, but the one that you have that addresses dialysis, what is it doing for those who have kidney disease?
Well, so the ones that the first step with kidney disease is catching it early and getting the tests done that actually really move the needle in that area. And so one is a lab technology that allows for the lab test to be done at the point of care. And what we find is that a lot of people don't actually get their labs done, even though they're ordered. So then their diseases are caught much later. So that's one. Another, there's 2 or 3. We have not invested in them yet, so I'm not promoting any one. But there's 2 or 3 companies that are really working on this, the outpatient dialysis process, which internationally there's a few technologies that have been happening, but in the US it's very, very rare that actual at-home dialysis is being done. There's been 3 or 4 initiatives that the IP and companies have been trying to get approved here in the US, and we're tracking all 3 of those because we think that would be something that would give back a little bit of lifestyle and the portability of a dialysis machine for what I would call early stage dialysis. I don't think you could do it if you're super advanced because you just too many risks associated with self-administering. But we're looking at things that make the lifestyle more achievable and better, and people that can get the care and those types of things, and everything in between. There's reversionary tactics that the research foundation tied to the board member that I mentioned is working on, and we're going to track all of them. So the whole goal is really, move the needle and catching it early, and never letting anybody get to that real chronic state.
Yeah. So with 30 years across Stryker, Newmark, investment banking, how have those roles shaped your move to Seed Healthcare?
That's a great question. It's a tough one because the journey of having knowledge of the clinical component is one thing that really helps me a tremendous amount. But then to top that, we already talked a little bit about Stryker. I mean, I was in the operating room teaching physicians how to do surgery, so I learned clinical from the inside out. Then you take the Newmark and investment banking. I was actually an early stage founder myself. In a company that actually focused on healthcare real estate before healthcare real estate was a thing.
Yeah.
And what we saw was that the third largest cost, you're a real estate family, as you told me, and the third largest cost of every provider is real estate, physical plant occupancy cost. And so when I left Stryker in 2004, I started a healthcare real estate and finance business. That helped me shape kind of the operational component of how to reduce costs in healthcare. And then I added that. I ended up selling that business and ended up working at Cantor Fitzgerald and Newmark, for a period of time as an investment banker, facilitating and growing that even more. And what happened through that, I saw the lens of the financial component of how you really impact and grew businesses. And when you combine it with the clinical knowledge, I can simplify healthcare really easily and get down to the pragmatic approach of how you actually monetize and drive value for companies that normally would have a hard time getting to the tipping point. So the combination of my background, I think, really shaped my thesis. Then my reasons why. Why did I actually leave Newmark and start investing in early stage venture? And my why was my motivation around preventative care and what I saw for. I left in really 2020, and I started looking at, well, what's wrong? 34 years later, I was still seeing the same break fix model, the same surgical components and the same challenges, and just next gen products that were being innovated that weren't really moving the needle. It was just like, okay, maybe it's a little more or less invasive, but it's not like really curative, and they're not really moving the needle. So I got really passionate about that. I invested in one early stage company that was all about proactive versus reactive healthcare, and that company's grown significantly, and we've done really well. And then I continued to invest from there, and that lens really shaped my thesis at Seed. And I started it with my own money and family office and that kind of thing. And then I started really going, okay, everybody wants to jump on board and get involved. So I had additional investors that wanted to come in, and then I had board members and what I would call prolific healthcare investors in the U.S. and abroad that wanted to get involved and wanted to be on our board. And then then all the clinicians got on board. So it just became this movement. But my reasons why were watching my dad die in the 60s, when he should have had a lot longer longevity, with a late stage cancer diagnosis, watching friends actually have heart attacks that didn't know they had heart disease in their 50s. And then really getting towards the trend of my own health and preventative care myself, and really getting those full diagnostics changes how I look at life and my age and my biometrics and kind of my vision for my life. I feel like I'm only halfway done, right, at 56, and I feel like I'm that's a good thing. So all of it kind of fits together.
The latest research shows that the life expectancy for people alive today is it's not 80 anymore. It's like 120.
Exactly. So that means I'm not even halfway done.
You're not even halfway done.
But the key, and Addie, this is the key for all of us, right? We all want to live a healthy lifespan. I don't want to be, 80 years old and not be able to open a door. Okay. Yeah. I want to be able to lift and do and move. And that's why I get off the couch every day. If you look at my activity level, it's pretty high. That's why I do the things environmentally to make sure I have muscle mass, that my hormones and my activity level and my energy level is right. I do the things that actually commit myself, that mean that I will have a healthy lifespan, and not necessarily. I don't know that it's the number. Like some people have a number in mind. I don't think that's my thing. My thing is live as long as I can, as healthy as I can. And by doing the things that I do that are preventative, and some people call it biohacking, all this stuff. I mean, I do crazy things like cold plunge and, all of that. But what you'll hear me say is, first, make sure that you are not going to get a chronic disease that you don't know about, right? There's no reason you can't eliminate those big risks every year with the technology that we have today. And so when I'm speaking, there's two prongs that I'm talking about. One is how you invest, right? Where do you put your money and what do you care about? And what's your mission and purpose, right? That's number one. I talk about that all the time. The number two thing, and not in this order, right? If I'm talking to a group of a couple hundred people, you can look around that room, and out of those couple hundred people, 14% of them have chronic illnesses they had no idea they had, okay? To me, that's too many. And if I can create awareness around a diagnostic or process that that actually motivates them to change, then I'm doing good in the world. And that's the movement and my why. That kind of is why it all comes around. And we can all make money a lot of ways, but if you can't help and move the needle and help other people, then I don't think it's that meaningful in the end. So that's my focus, and that's kind of how I get to it. And it seems to be working. Now, whether I do that till I'm 120, I have no idea. But I like the idea if I'm healthy and I'm able to do that. So let's keep going.
I like that you brought up cold plunge. I have an ice bath downstairs.
Sweet. All right.
Yeah. So
what temperature do you keep it?
55.
That's a good temperature. I think anything under 60 is good. I keep mine a little lower, but I think, if it goes down to in the 40s, like 42, feels a lot colder than 50 to me. Like it really does. That 5 to 8 degrees makes a huge difference. But it is compelling, and it does, for some people, it's that managing of cortisol levels and your reaction to different intense activities. And when you look at my Oura Ring data, mine stays pretty flat. Like I don't go like this and that, and they say that's a good thing.
Yeah.
But I'm not. I have a pulse too, though. So like you have to have both. I think it's kind of balanced. So that's cool that you do that.
I did. I picked 55 because there was an article or there was a research that came out I was on the NCBI website,
Mm-hmm.
and they said they found that people who did an ice bath for at least 10 minutes per day, 55 degrees exactly, they, after 6 months, they noticed that they had higher natural killer cells for the red blood cells. That's a type of red blood cell that kills cancer cells, for those of you who don't know. But yeah,
Exactly.
so that's why. Yeah.
The other thing that it does, which I think is very interesting, is the whole, and I don't know if you read this too, you probably did, but the whole brown fat and white fat cell type of thing. If you do, they say 11 minutes a week at 55 or below, your cells, your fat cells that are really dead cells, the white fat cells that you have in your body are dead cells. They convert to brown fat cells, and brown fat cells are the cells that you have that are fat when you're born, right? It's functional fat, so it keeps you warmer. It actually has a functional aspect to it, and there's a lot of literature on it. So I think that also promotes more healthy cellular function, and that goes to the killer cells. And I think that's great. It's that you do that. Whatever helps us kind of move the needle and stay healthier, I think is the overall strategy.
So back to our questions, we keep getting sidetracked.
I like the sidetracks though.
So you serve on several boards. How did these align with your mission and inform your work at Seed?
Great question. There's several boards that I'm on because we're helping the companies grow. And when you look at companies that are early stage, there's 3 reasons they fail. Okay. One is governance, a lack of governance. And I'd say that we do that pretty well. We have a great team of people that are also on boards that are within our platform, that are our board members, that also actively participate. The second reason that they fail is they run out of money. So actively helping them govern and regulate and do, and then helping them execute things that they can't do themselves because of the knowledge, and they can do things faster. They don't run out of money, and helping them fundraise. The third is that they don't get to the tipping point, and that really is the sales part. If they don't actually get products inserted into the fabric of care, it takes a long time for a company to kind of get to that scale. So our leadership and how we actually drive the impact to the companies that we invest in is that commercialization. It's the governance. It's the ability to raise more money, because the theory is they don't need as much money if they're getting sales. They don't burn as much if they have more efficient approach. So that's kind of how we roll it out at Seed. And it's very different, I think, than many venture firms. Many venture firms are on boards to help govern their own investment and look out for their own interests. Ours are to really promote and drive the interest of the company. So we're making introductions, we're hands-on, we actively have recurring meetings plus board meetings and all the active roles in driving sales and commercialization that really make a difference for the companies that we invest in.
We're putting together the board of advisors for my real estate fund. And so far, people coming on the board, they were like, the deal is if I'm on the board, you let me put more into like a deal. If it's coming in, I want to be able to take a bigger slice of the pie, and I want first dibs. It was like, those are the types of people I want on the board. So someone yesterday, he's like, well, you should pay my friend to be on your board. And I was like, why would I do that when I have active investors who want to take that seat instead?
Exactly.
Yeah.
Exactly. Well, and when you look at a fund structure, it can be challenging, right? The venture world, and then you look at real estate, it can be challenging in all those areas. I think that the more value you add, right, whether it's real estate or a portfolio company that's in venture, the more you tangibly can add value, the more you're really growing and driving that impact. And that's when people want you on the capital table. The days of this passive, I'm going to just put money in and create a return is somewhat over, in my opinion.
Oh, yeah.
So,
there's nothing passive. I don't know. Maybe I'm too young to know the years of when it was passive investment. But do you know Paul Hutchinson or John Pennington?
Yeah. Yeah, I know Paul. I know Paul well, actually.
But did you see his episode on 9x90?
I didn't. I need to go back and watch it. He's great. What he's done for child trafficking and all that. Paul's great, and I know his son Jordan as well. They're great people.
Oh, did you go to Judson Capital?
I did.
I was there too.
I was there. Are you going to the New York? There's another New York event, I think.
I am promoting it with my following. I'm not sure if I'm going yet.
Yeah, I'm not sure yet either, but we may see you there. That's great.
Yeah,
and
great.
it's I like what they're doing. I really, and also Paul's mission is impactful. You talk about charities, and I know you asked about the philanthropic aspects of our business. The idea that that we are aligning with a variety of charities to give back and help drive kind of the outcomes. You also look at like the big foundations, Chan Zuckerberg and some of those that invest in rare disease, and they focus on creating a flywheel of IP and data. But what they're having a real hard time of getting across the goal line and kind of circling, making the big flywheel work, because they don't get to the commercialization part, and the clinicians are really needed. So it's an interesting dynamic, and we're looking at a lot of strategies of how Seed aligns with those, call it rare disease organizations, the philanthropic component. And it's compelling to be around people like Paul who have walked the walk and talked the talk, right? And really made it an important fabric of his life, as a founder and as he grew his company. So it's very neat.
His advice to me was that every week I have an investor call, and if something went wrong, I tell them how I fixed it. And if something, like, no matter what, just be standard, and every single week you have an investor call. Whoever wants to be on it is on it. And then his co-founder, Mr. Pennington, wrote a story in this book. The book I wrote, it hit number 2.
Oh, really? Cool. I'll
Yeah.
have to get one of those. I'll have to read it.
Mr. Pennington wrote, when I was like not sure if I was launching the fund, he's like, just add this to your book. And I read it, and it was like, this is why you're ready to start a fund. But
amazing. It's such a small world that we have going on here. So it's great.
Yeah, on the philanthropic side, almost all of the Brown trophies behind me are philanthropic. And then
amazing.
That one right there, my grandfather got, He received that one after he convinced all of the other international nonprofits to work together to eradicate polio decades ago.
That's amazing. That's there's when you think about the little things that happen in the world that people don't even realize, right? And different human involvement. Your grandfather, for example, that moved the needle.
Yeah.
It's so interesting because, and maybe you got this when you were younger. It seems like you have. The mission and purpose impact is missed, and I'm like, I was told, okay, go make money. I was 20 years old when I graduated college, and the journey was go make money. I had to make a living, and
Yeah.
I never really looked back. I just kept doing, but it was not until later that I really realized the combination of mission impact and how I got into healthcare and all of that. It was by happenstance. It wasn't like I said with intention. I got into healthcare, and then so you start to then go, well, why did all this happen? And then how did it become my mission and purpose to change it all? And how did it become your grandfather's mission and purpose to change polio and the impact of polio, right? Like,
Yeah.
so and back then it maybe there was less awareness and all the rest of it, and now everything travels at the speed of light, like this podcast and all the things that are happening. So I find it to be very interesting. How do people today get their mission and purpose and become clear about it, right, at a younger age than I did necessarily? I think it's an interesting topic. We could probably have a whole podcast on that.
Yeah. So my family's been in Rotary for 3 generations.
Mm-hmm.
And my grandfather was an international director.
Wow.
Yeah.
So he was one of the guys.
Yeah, one of
Yeah.
That's the second highest level of leadership. And one of my mentors now, who also wrote in the book, she just finished being the president of Rotary International. So in our family, it was starting when you were like 5 or 6. Once a month, you would have to go do a Rotary charity project. Either like
Amazing.
tree, feeding the homeless, like all of that. Like there was never a, do you want to do something philanthropic? It was great. You're 5 years old. You can walk and hold a shovel. Let's go.
I think that's the right way. You start with, begin with getting it in the fabric of your children's lives, right? And then hopefully they start to adapt that as they start to go through their education and whatever education looks like in the next 10 years will be interesting too. But the idea of how they attach to some sort of mission, purpose, and drive and outcome, I think is a key ingredient to how this younger generation is going to kind of mature. And, hopefully we can keep instilling that in the fabric of the community. I think it's important.
Yeah, absolutely. So tell us about a life-changing moment that happened in your career in healthcare, and how did that deepen your purpose at Seed?
Let's see, a life-changing moment. If I go back, there's probably 2 that are very, very notable. One was my dad's illness. I mentioned that earlier. He was diagnosed with stage 4 lung cancer, and he smoked years before, like 30 years before, when the Marlboro Man was getting all the girls, and it was one of those things. And everybody smoked back then, and he ended up getting lung cancer. And what I realized, he also was diagnosed with stage 4, and he really didn't have any chronic symptoms. So to me, as a healthcare person, I was around him. I didn't, he didn't have trouble breathing. He didn't have nothing, but it was still stage 4, which was had metastasized, and his pulmonologist said, you got a month to live, and he ended up living a lot longer, a year plus. And we took him, to MD Anderson, and we did the best we could with his illness, and he did well. But the real impact was, if it can happen with me, who's very in tune with what's going on with healthcare, right? Like, how does it, and a simple CT scan would have caught it, right? So, he had been to the doctor, had been around it, and they just didn't order a CT scan, right? And if you look at that that physiology, and you say, okay, if they listened to his lungs, they still couldn't hear it, right? So how do you, if that's the case, your body lies to you, you have to be thorough and process oriented around what diseases you eliminate every year. So for me,
Yeah.
that was eye opening. That even within my own family, that would happen, right? And that was quite a few years ago. It was a long time ago, and it just kind of got my preventative care mindset going. I also, and I'm going to share one other. There was an old surgeon, actually at MD Anderson. So when I was first out of college, my first healthcare job was with US Surgical, and it was just before Stryker, and I was with them for a few years, but I was with some of the best surgeons in the world. DeBakey, I was with, incredible surgeons. I was in the OR teaching them how to do things in a more minimally invasive state. And I'll never forget this older oncologist was like, son, and he was older and I was young at the time. He's probably in his late 60s or early 70s. And you think about a practicing physician that had been through it all and had lived through that era of healthcare, and now was learning how to do things on a more minimally invasive basis. He's like, son, all this minimally invasive stuff is really interesting and all. However, our goal as a doctor needs to be to manufacture a well patient. And we're still just treating it as a break fix model. He said this was in like 1993. Okay. And you start thinking about that, and that stuck with me. I was like, all right, when you think about manufacturing a product, right? You've manufactured products. You were talking about China and how you were dealing with that and supply chain and da 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 da. When you think about the manufacturing process, if we take that lens and we start reflecting that on healthcare, just think about the outcomes we would have, right? Our goal is to manufacture a healthier patient and drive real outcomes instead of just covering up the symptoms. And if we get to that, so those two things really impacted my journey at Seed and really why I'm so passionate about it. And I find that if I keep those at the front and center, and I really remember that we should be catching disease earlier. We should be doing this. Nobody should be dying of a heart attack today. Nobody should die of a late stage cancer diagnosis. They should know that they've had it for years, right? And if that's happening, and sometimes you lose the battle, and that's unfortunate. But if you know about it, you can definitely lengthen the battle, right? You can also potentially reverse it completely, and there's a 90% cure rate for cancer if you catch it stage 1, right? Like that is massive difference between a 90% death rate at stage 4, right? It just flips on its head, the whole program. So anyway, I can go on my soapbox about this for hours. So
I will sit there and nod the entire time because I agree completely. You're like literally preaching to the choir. Yeah. My father-in-law died of stage 4 pancreatic cancer, and they didn't catch it until it was stage 4. And they did the same thing. They said he had like a month to live. He lived another year and a half, because we had like just had our daughter, and that was his first granddaughter. And they think that like
so you got to know her, or you got that kept you motivated.
Gave him, like some motivation to hold on a little bit longer.
Wow.
But
wow. Yeah. I mean, actually, the year that my dad lived an extra year and a couple months, he got married. He actually got to know my kids, who were 7 and 6 and 8 and 7 when he passed, and they remembered him more because of that time. So some of that is invaluable, and that will to live. That was the conversation my dad and I had. It was like, do you want to live? Like, how badly do you want to live? Let's go for it. And, that's why we went to MD Anderson. That's why we did the things that we did. And I tend to give people a lot of advice around their care. And, I'm all about, be as aggressive as you can with your own care, and be the CEO of your own care too, because you don't know what you're going to get out of that. And those connections with our children, it was super meaningful to me. So it's great.
So now let's move to the investor side of things. We've talked about mission, alignment, being on the same page with everyone. You're seeking investors that are aligned with both profit and purpose. what qualities or metrics do you look for in your backers?
It's a great question. Generally, they'll have a why that they care about healthcare. Okay, so just like I've iterated mine, I think most of our investors kind of they they have a why, and I'd say that's number one. So their impact is being driven by that, and they care about impact. Now, most impact funds don't have outsized returns. Ours does. Our objective is not to have shorter returns, lower returns. It's actually to have outsized returns because of the commercialization network and the clinical network that we have. So our focus for our investor profile is they're people that actually have some knowledge of healthcare. They are passionate about it. They may want to be somebody that lives a long time, right? They get passionate about those things, and they also want to have a voice around it. And so we welcome our investor community is more of a community than it is just a passive check from investors. Not that they go to work for us or anything. It's more that they become an advocate for what we're doing. And that investor might be a doctor. It might be a clinician that's on our board. It could be a passionate investor who wants to also vocalize or had a parent or a challenge or something like that. And that's really our profile. We've done well in fundraising, but it's been a fun process to actually learn and meet people and what really is the perfect profile. So people that actually have knowledge really, we can kind of get past the what are we doing part a lot faster. And then the intention of having outsized returns, they get it. When we start saying the largest practices in the country are affiliated with our board, they start to realize, well, you can't change healthcare in the US without actually having the clinicians aligned, and a carrot of some sort is a real incentive for them. And we've got them all. When I say they're aligned with our board, they're actually really tied to the board. They actually have incentive for us to have great outcomes and to weigh in on the technology. So those profiles, people that actually get that profile really are what we're looking for in our backers.
Do you have there's two questions left. So one is what are some tools and tactics that you use to manage your time and your team effectively? Because you said your team's all over the world.
Yeah, that's a great question. Tools. Well, if I didn't mention AI in a podcast today, I think it'd probably be, out. We hadn't really talked about that. But I use as much technology as I can. We do a lot of meetings virtually, but we also, have to be in person at different events and that type of choreography. So we balance our schedules.
Yeah.
I've built a team that I feel very compelled, allows me to get my head up and commercialize the companies that we do. So I'm balancing it with technology and people. Regardless of what AI you're using or how you're using AI, everybody's still learning the applications. But I'm a big proponent of actually embedding technology into the fabric of how we make decisions. Data and analytics is something that we've been doing for 20 years in the healthcare, finance, and real estate world and investment banking, and we make data-centered decisions. So if we know we can move the needle, we do that. For example, we've created a network model that we've embedded into the fabric of our platform that has all of the clinicians that we have a connectivity to. And we know our connectivity, and it's all the dots are connected, so that when we say, oh, we're going to commercialize this product or this company or this, we can literally give them what seeds market TAM looks like to the portfolio companies we're looking at. We can also then use that as a roadmap to go engage the providers and actually drive outcomes. So for us, we're enabling ourselves with technology. We're using effective CRM tools, fundraising tools, anything that we can utilize, and we work hard at the same time. So work hard, you use and enable technology, and I think those are the key fundamentals. And make sure you're focused on the big rocks of the things that you have to do every day. I think that's what people miss. They fill in with sand instead of of focusing on the big things. And in venture, you have to find new companies, you have to commercialize, you have to drive the impact you say you're going to do. You got to do what you say you're going to do. I loved your thought about weekly calls.
Yeah.
Weekly might be too frequent for our investors, but we're doing, definitely monthly calls, and we communicate. Over communication is key. So it's a good thing.
So what is the best way for those who want to pitch to get in touch with you, and what is the best way for investors to get in touch with you? Because you probably have two systems by which those both come in.
That is great. They can personally email me at todd@seedhealthcare.com. We have a deals team that you can do deals at seedhealthcare.com if you're submitting a company. There's also on our website, there's a link you can fill in a questionnaire and get that. It goes directly to the deal team and kind of gets prioritized based on category, and we review those every week. Then for investors, they can reach out to me or our IR. It's ir@seedhealthcare.com. And we have Rich Hurley, who runs our investor relations and formations team. And those are the two best ways. You can also track me down on LinkedIn. We have Instagram and Facebook page under Seed Healthcare, or my own personal one. We do also have a podcast, which Addie will have to talk about having you. I can't wait to interview you. That'll be a lot of fun. And that's called Killer Cure. And if you look that up, it's got a lot of good health tips. And I co-host that with one of our board members, which is in our investment committee members, called Killer Cure. And really that's it. And if people have interest in what we're doing, we're happy to collaborate with them. It takes a village in venture to really drive the companies to the tipping point. But we get asked by the big funds, by all the big groups to join in the capital table, because they know we're going to do work that is really going to drive the solid outcomes for the companies that we invest in. And that drives outsized returns while making an impact. So those are the real measurements that we track down, and that's how to get in touch with us.
Okay. Very cool. Well, thank you so much for answering all of my questions, which were preset and not set at all. I appreciated the conversation and going on all these tangents and ripping.
Yeah. Think of the tangents we'll have on our podcast. I mean, just no guidelines. We'll just do a total no holds barred conversation. And I really enjoyed it. And thanks for having me on, Addie. I really think what you're doing and getting your voice out there is important. And if I can ever help in any way, please don't hesitate to reach out.
All right. Cool. Well, thank you all for tuning in, and I'll see you back online next time. Bye.
Thank you.